Okay, and we're back. Thanks everyone for sticking with us. We certainly appreciate all of you for taking time out of your busy schedules to be with us. And we went from a panel of all men to a panel of all women. So yes, we try to be diverse in our thinking as well as in our representation. And now we want to talk about this issue of mental health today. And we do know that this is something that has been at the forefront for most of us, particularly over this last year, with so much happening as we have all tried to grapple with this pandemic. And so we have with us Dr. Erica Richards. She's with Sibley Hospital here in Washington, D.C. Dr. Danielle Dooley with Children's Hospital, also in Washington, D.C. And way out on the left coast in Northern California, which I did not know until yesterday, is the home of everything, is Erin Bodanski. She's with Thera, Inc. And before we actually get into a conversation on mental health, I would like for just each of our panel to just say a little bit about the work that you're doing and talk about the impacts that you are seeing, particularly over this last year in terms of the issue of mental health and perhaps how the pandemic has shaped that. And let's start with Dr. Richards first.
Thanks, Eric. So it's a pleasure to be here. And I think that this is such an important topic. A lot of times I'm asked, well, how are most people coping with the pandemic? Or what if I've developed anxiety during the pandemic? And to that, I would say that you are certainly not alone. So a little bit of background for me. I am the chair of psychiatry at Sibley Hospital, which is a Johns Hopkins community hospital located in Washington, D.C. We have seen a lot during the pandemic. We have an inpatient psychiatric unit. We do emergent consults in the emergency room. We do hospital consults for people that are in the hospital for other medical reasons. And we have a small outpatient practice too, where we can provide longitudinal care. So what are we seeing during the pandemic? Well, we know a CDC pulse survey showed essentially this is where they're taking the pulse of households. How are we doing in terms of depression and anxiety? And when we compare results from households in 2020 to 2019, what we're seeing is about a 4-fold increase in people that are experiencing symptoms consistent with anxiety and depression. So how are we doing in the pandemic? I think we're all trying to get through this, but if you're noticing increased anxiety, some periods of low mood, just that's not uncommon and you're not alone.
Thanks so much, Dr. Richards. Dr. Dooley?
Thanks again for having me today for this important conversation. I'm a general pediatrician at Children's National, which is a children's hospital in Washington, D.C. with over 300 inpatient beds, and we have multiple outpatient centers, and I work in the outpatient setting, seeing patients from newborn through age 21. And I think I'll start by sharing my least favorite sentence in the pandemic that we hear over and over again, which is that children are resilient. And yes, children are resilient, but that's a very incomplete sentence because it doesn't take into account the people, the structures, and the systems that are really needed to support and scaffold that resilience. And a few examples of what I'm seeing in my practice. So for the very young kids, parents of newborns are under unprecedented stress. It's been over 100 years since people have had a newborn baby in a pandemic. So the stress and anxiety among parents of newborns is incredibly high. For some of my older children, particularly adolescents and teens, the strain of virtual schooling this year, being on camera all the time, has really increased their levels of depression and anxiety. And then I would just add another big component of my practice. I'm very fortunate to be able to care for a number of children and families who've immigrated, particularly from Honduras, Guatemala, and El Salvador. And many of these children have actually arrived at our southern border as unaccompanied minors and then have reunited with family members here in DC. And what I've really seen is without access to in-person school, a lot of the supports delivered in schools that help with family reunification, help with adjustment to a new country, are no longer there. And also we have to remember our schools really support positive mental health through access to nutrition, physical education, caring adults, and school-based mental health services. So that's just a snippet of what I've seen. And I'm so glad that we're having this conversation today.
much, Dr. Dooley. And Miss Bodanski, I am so sorry for butchering your name earlier. Let's hear from you, and also share with our audience in particular what exactly Thera Inc. is.
So I'm a psychotherapist. So I'm a full-time provider, and I actually invented a technology which is live streaming virtual reality as telehealth. And so I'm more on the telemedicine side. And so what Thera does is we're actually allowing providers and patients to meet in VR. And it's done over a headset technology, but it's also done on desktop computers and tablets, and we're moving into mobile. But my passion is working with children, with pediatrics. And so going back to the impact of COVID and what this has done on children is exactly what Danielle was saying, is that we've seen this surge of mental illness and conditions that we weren't anticipating. And so my technology is an adjunct to traditional methods of counseling. So it's more allowing a patient to feel empowered by choosing avatar technology. And what's unique about what we do is we allow children or even teenagers or young adults that they actually can choose what their provider looks like. And the benefit of that is, from my background living in the Bay Area, which we have a lot of diversity, it allows the patient to choose different ethnicities. For LGBT communities, it allows a patient to feel more comfortable with their provider by allowing them to choose, a very diverse sense of avatar representation for their provider. And then on top of that, the experience of using VR as opposed to going into, your traditional office, which doesn't happen anymore because of the contagion. There's 7 different clinically appropriate scenes that a patient can go into, but they're getting more, and this is most important about the treatment itself, is it's more focused on a health psychology perspective. So you're not just having talk therapy, but you're actually getting what's called behavioral activation. And what that means is that you're using a full mind-body experience, which is only delivered in VR, as opposed to just sitting in front of a regular telemedicine video conference screen. So that's what Thera is.
Thanks so much for that. And now I want to open this up to this larger conversation because so much has been exposed, so much has been placed in the spotlight in the wake of COVID-19. And of course, one of the issues has been, how do we confront the pandemic in terms of our physical health? But we also have to recognize that there has been a mental toll that the pandemic has taken on communities, and more importantly, children. And so if each of you could talk about what exactly, or some of the specifics that you're seeing, and how to actually bridge the gap to make it, or to get to a place where people at least can confront the issue of the fact that they need mental health. And in our last panel, one of the key issues that came out, it was a panel on innovation. There were all of these innovative things that the doctors are doing, but one of the barriers that each of them mentioned was the barriers that the public, the community themselves had to actually taking advantage of this innovation. And so I wonder if that is a problem, a barrier, or a challenge that you all are confronting as we try to find a pathway to make exploring and addressing mental health issues more palatable and more comfortable. Dr. Richards, let's start with you.
So we are seeing different responses for the pandemic at various age groups. And you could highlight, I'll go backwards, and I'm going to end with children since that's the focus today. But if we even start with aging populations, with the elderly members of our family and our friends, we saw a change during the pandemic. And for their own protection, right, so that we could keep them safe, what we said is, okay, you guys stay there, we're going to stay over here, and everyone will be safe. But safety and health require more than that. So we saw dementias getting worse. We saw anxiety in aging populations getting worse because they had lost a lot of their comfort zone. They had lost mental stimulation. And so that is kind of the response that we have had to try to undo a bit, right? Nursing homes were not allowed to have visitors for such a long time. And what that does to someone that actually needs interaction is significant. And then we back up a little bit more. I'm going to skip some age groups, I know, but we back up a little bit more to, to adults that are not only caring for that aging population we said, but may have children at home and now have to navigate virtual learning in that environment. And then what we saw was, and there's been a lot of reports lately about women in particular, often feeling like they had to choose between helping at home and caring for the aging populations or the young populations or working. And what did that do to their anxiety levels, to their mood levels? So we had to navigate that. And then if we go backwards a little bit more to the young adult population, what we saw is that they had just kind of sprung out of the house. They had just gone to college, just started their first job, just moved into their own apartments. And the pandemic sent a lot of them back home as well. And now they're navigating living at home with parents, and probably with parents that are saying, please don't go out. Please don't get to see your friends. We need to stay safe, at least during the beginning of the pandemic. And if we back up all the way to the younger populations, from a psychiatric perspective, we can see anxiety manifested in different ways. Sometimes it's just physical symptoms. Sometimes their stomach hurts or they have a headache. Sometimes you cannot get them to log on to that virtual session, no matter how hard you try. And that's when we want to talk about how often is it happening? How much is it disrupting their learning environment? But what we're seeing are those changes across different ages, and all have to be addressed in different ways.
That's very striking, particularly when you talk about the aging population and how they lose that connection and how that's exacerbating some problems that are manifesting themselves as health problems. And oftentimes, particularly in the policy world, we like to place everything in boxes. And so oftentimes those boxes never really connect. They're siloed. And that's what we're seeing with this conversation, that there is a connection to all of this. And Dr. Dooley, I'd like you to pick up on that and talk a little bit about what you're seeing and how you all are addressing these problems where you are.
Sure, thank you. And thank you for providing that sort of timeline, Richards. I think that's really helpful as we consider, the impact of the pandemic on mental health across all of the age groups in our population. I think that a couple really important things that the pandemic has highlighted are, first of all, this need for multi-generational access points for mental health care. I know that's something we have really been working on at Children's National. But if I'm seeing a newborn and the parents are coping with, high levels of stress and anxiety, it is very hard for, that newborn and that family to thrive without access to supportive services. So, we're fortunate at Children's National, together with multiple partners across our region, and particularly through the Clark Parent and Child Family Network, there's been a big investment made in both prenatal access to mental health care for pregnant mothers and then early childhood mental health care. So, for example, in our outpatient centers at Children's National, what this looks like is an early childhood mental health specialist working alongside me in the health center, so that care is right there and right available, as well as really strong partnerships with community-based organizations like our colleagues at different organizations and at other hospitals like Sibley, where we can get access for parents to mental health care. So I think, first of all, that looking forward at where our system needs to go, any touch points with the health system have to provide mental health care access for, multiple generations of the family. I think the other really important issue that we must address going forward is really recognizing the historical roots of our mental health system and how much of it was designed to oppress and dehumanize people of color, and that going forward, we've seen the disparities in access to mental health care and quality mental health care for patients of color. And I think that's something that all of us have to work on going forward, so that, just as you were saying, Eric, populations can avail themselves of those services, but those services have to recognize the very painful legacy around a lot of mental health care treatments and institutions in our country.
Dooley, I want you to touch on this because you're also dealing with another piece of baggage on top of that, and that you deal, that was not the right term, but what I mean is you also deal with migration in terms of families that have recently migrated to the United States. And so that's another added layer to this component that's already complex, that already perhaps isn't or is struggling with already so much. And so what does that mean when you have this mental health component in the middle of a deadly pandemic? And also we're talking about families that have recently migrated here. And so they're trying to navigate this entire labyrinth of different services that they may not even know or be aware that's available to them. I mean, how do you deal with all of that? And can you talk a little bit about how you and your hospital, you navigate this process?
Sure. I mean, I think a couple things are important. As I mentioned before, schools have been a really important source of resources and support for children and families who have immigrated to our country. The virtual schooling and less access to, for example, English as a second language services has had a tremendous impact on families. And in many cases, particularly if it is a child who's coming here to reunify with other family members, they may be reunifying with a family that's under extraordinary stress. For example, may have lost a job due to COVID-19 and its impact on the economy, may have lost family members due to COVID-19. So those are some of the challenges we're, partnering with families to address in our primary care practice. But I would also say that, this is where the system solutions are very important. We're very fortunate in Washington, D.C. As Dr. Richards knows, we're one of 5 jurisdictions in the country where people who do not have, a legal status in the United States can get access to healthcare and health insurance other than through the emergency room. And so being able to reach out to families, make sure that they are accessing healthcare, have points of entry into the healthcare system, that really starts with a system level solution in a jurisdiction providing access to health insurances and services in that region.
So much. And Ms. Bodanski, I want now to go to you because you are also working on these issues, particularly with children, and your VR work, it sounds really fascinating. And so I'd like for you to talk about how you too are navigating this situation, particularly as it relates to young people, given that there's so much stress that we're seeing right now. But also, you mentioned that you're able to create these different avatars that allows people to who may not normally access or engage in mental health care. This gives them the ability to do so now.
Yeah, no, I just wanted to thank Dr. Richards and Dr. Dooley for sharing the systematic issues, on access to care. And that's really my mission, is to bridge getting to those communities or populations that are adverse or unknowledgeable about getting treatment. A lot of first generation Americans or new immigrants, they don't really know what is mental health, or is that even a service. And what I really focus on, and this isn't just with my technology, is about training and education and awareness. And a lot of that starts at the state level, right? So with our state healthcare systems, even in California, hundreds of, tens of thousands of Californians are without insurance. And because of the pandemic, so many people lost their jobs and families were affected. And then with children, on top of that, they had a very limited access to paying for psych services. And so one of the things that I think is really important to address is that we getting the insurance to be more at parity for state level delivery of care should include more wraparound services. And what I mean by that is, having access to psychiatrists, so MDs, as well as support resources for the entire family, because it doesn't just stop with the child. When you're getting, if I'm counseling, like most of my patients right now, my referral base coming in, they don't even have insurance. And that's a problem, because I'm in private practice, and it's really difficult for me to turn somebody away. My goal with Thera is to never turn a person away. And I think that we have to solve these problems now to bridge a more universal delivery of care. And I think the solution to that really is through telemedicine. And so it's accessibility, modification, and adoption. But with VR, to answer your question, Eric, I'm allowing a new experience for the patient. And it's not a game. It's actually redefining how you see your provider. And so with the avatars, again, for children are a lot more tech savvy. And because of the contagion, they've been confined, they've been homeschooled, they get so much screen time, but they've been burnt out from it. It's really hard to get a child to get on a screen and do more Zooming. They're exhausted by it. So it's really challenging for us providers to get them to show up. And what I've noticed with my own patients, they are excited about using the VR. As soon as they see that headset, they want to put it on. And what is a comfort zone to them is the empowerment of being able to choose what they look like. And there is a clinical efficacy in actually showing that if my child patient or even a teenager, adolescent, can choose what their provider looks like, it reduces a little of that stigma of like who they're speaking to. Because as us clinicians, there's a lot of pushback. Children can be very intimidated by their provider. So when I let a child choose, hey, maybe they don't want to have a female therapist, maybe they want to have a male, maybe they want to have an African American male, maybe they want an African American boy, like a child instead of an older person. These choices for a child are empowering. And then on top of that, the experience that we provide as clinicians is the actual spaces that we provide. The whole concept of what Thera is, I created this based on my experience working with severely at-risk youth. So my population is working with suicidal, self-harming children and teens. And so when I created Thera, it was under the notion, well, they're spending all this time in the hospital, and it's scary, it's loud, it's uncomfortable for them. What they're really seeking in terms of getting a therapeutic experience and building rapport with their clinician is let's create a safe space for them. And that's what we provide in the VR. So there's 7 different clinically appropriate scenes, and it allows that experience for the patient to feel like they're in a different world, and they can open up, and they can share in that session whatever we're treating. So it could be CBT, DBT. I do a lot of trauma-focused therapy with children in VR. And it's highly effective. And in our clinical trials right now, we're building one of the first evidence-based treatments using acceptance commitment therapy. And this is specifically to treat college-age students. Due to COVID, you have a whole population of young people that through at the college level that had major disruption in, you know, their experience at college, and you've seen the rates of anxiety and depression go up. And now that particular type of counseling is actually very popular with 20-year-olds or anyone under the age of 30. Combining that with the VR experience is combining the notion that these younger populations are a lot more tech savvy, and that's kind of the marriage between the innovation and the delivery of care.
And so that gets us into this discussion around the therapeutics and what types of services are available. And we've talked about children, but for our global audience, who oftentimes does look to the United States for care, and so they are probably looking and wondering, you know, how to navigate this space, you know, even though now there may be this struggle of getting into the United States. But again, this issue, again, of mental health. I mean, I think this is something, while we know there's care available, I think it's still the challenge of actually getting people to take advantage of it. And so if you can talk a little bit about some of the things, some of the innovative treatments and therapeutics that are available, that are out there, that might, you know, prick someone to say, okay, this might be an opportune time for me to take advantage of that. Dr. Richards, let's start with you on that.
Sure, absolutely. And quickly, I think before we even do that, I want to highlight Dr. Dooley and Ms. Bodanski. What they were talking about essentially, you know, when Dr. Dooley mentioned the cultural sensitivity that's needed to treat certain populations, that is really number one. And that's what we're seeing is starting to be highlighted. You know, the past year was not only tough because of the coronavirus pandemic, but there was, you know, a movement for more social justice and policing, in medicine. You know, I think people are starting to want to have a discussion about cultural sensitivity when they receive their care. And so having the avatars, having, you know, allowing children to really select, have a voice in who essentially they're talking to, who they're providing information to, is important. You know, if I take it to the African-American community for a second, what we're seeing is a lot of people want providers that look like them. They think that culturally understand them. And yes, that is most likely to happen with a provider that looks like you, but not always. Dr. Dooley has said, look, this is a specialty that I have. And I've worked with a lot of populations that have immigrated to the United States. And so I have an understanding of some of the things that we're facing. So when you're looking for therapy, when you're looking for care, one of the things you do is have that discussion and feel empowered to have that discussion. This is what I'm dealing with. How can you help me with this? And there are forums now where that's available, where you can understand what the treatment plan would be from a provider, what their background is, what they're interested in. And so that would be one thing that's important. I mean, at Hopkins, we have Hopkins International, which is able to do some international work with certain communities. Now that happens in different ways. Prior to the pandemic, it was actually bringing people for consultations in specific environments. But that brings up again, well, what can we do in a virtual setting? And that's still evolving. I mean, I think a lot of people have been able to reach out and receive more support during the pandemic simply because there were things that were waived. We were able to now practice medicine across borders more easily. And that means that, you know, across borders for states even more easily. And so we were able to really connect with people where before, certainly we weren't able to travel to them, and they might not have been able to come to DC or Maryland or Virginia where we're licensed. So I think the key is really to engage in the virtual platform, if that's what we can do at first, but to ask questions, especially when we talk about children, right? We said that a lot of times they feel powerless, but we need to be able to give them some of that power back to play a role in establishing their treatment plan. And I think that's when we'll see the best outcomes.
You brought up a lot there, because this issue of, it seems as though the pandemic has, you know, given given us some opportunities to be able to expand, to be able to think outside the box, but also it has kind of like placed this mirror in front of the mental health community to say, how can we be better at what we're doing to ensure that we're able to help all communities? And when you're talking about children and giving them back some of their power, I would imagine the powerlessness that many of us have felt, particularly in the wake of the pandemic, where we are powerless to do X or powerless to do Y. That is a level of anxiety I'm sure that we're seeing that's exacerbating the problems among these communities, no matter where you are. But has that provided a welcome opportunity? And is the mental health community, are you all looking inward at yourselves to say, okay, what can we do better, or how can we be better? And has the pandemic perhaps given that opportunity to do that?
It has given us opportunity to learn. I mean, one of the things that we can say about the pandemic is really nobody was prepared for this. So we have certain skills that we know work. We have certain therapeutic techniques that work. We have medications that work. But in general, we are still learning about this too. So it is an opportunity for us to go back and do the checks and balances. Well, this is what I usually would have recommended. Did that work? Usually I can manage this as an outpatient, but should I have recommended inpatient admission to get them better faster? I mean, these are things that we are still learning. And Eric, you mentioned even looking at, therapeutics and how do we treat patients? And a lot of times there's a hesitancy to bring things up or to mention I'm struggling in this, mental health realm because, I don't want to be on medications, or they're just going to recommend medications. And I think it's important to highlight the fact that sometimes medications are the answer. This is the medical illness that we talk about, depression and anxiety, but sometimes therapy is the answer, and we can get people better often with therapy alone, but sometimes it requires both. And the timing of that is really important. If we try to do therapy on a brain that's too anxious, they're not going to be able to process that therapy. They're not going to be able to really understand the interventions that are being recommended. And so that's why we think reaching out to a professional will help determine what those treatment plans need to be moving forward.
And Dr. Dooley, I want to bring you into this conversation because you work with families that have migrated to the United States. So you're working with a very broad audience. You're working across border. And so what are you seeing, and what are some of the opportunities that you see, particularly that this pandemic has given you to be able to look at where you are, make some changes, and kind of shape your delivery in terms of how you're providing services?
Thanks, Eric. Yeah, I think I would highlight three things which draw a lot on what Dr. Richards and Ms. Bodanski said. But I think, the pandemic has really hopefully opened everyone's eyes across the world to the importance of mental health, and that it is here to stay. And we have to find some new and different ways to support and scaffold mental health for children and adults. And I think there's a few opportunities the pandemic has illustrated. I think first, as Ms. Bodanski was talking about, and I'm sure Dr. Richards' team has also gone into this, but telehealth. For example, in my practice, we weren't doing medication check-ins by telehealth for ADHD medication refills, and families would have to come into the practice, which takes time away from work and time away from school. I think telehealth now offers, while there are certainly some challenges, and it can be very challenging to do telemental health in terms of thinking about a patient's privacy, disparities in access to internet connection and electronic devices, it does offer some opportunities to reach broader populations, and particularly to be maybe less disruptive in people's day-to-day life when they aren't trying to navigate transportation to a health center, for example. So I think telehealth has been a real opportunity. I think the second are things like novel therapeutics, like Ms. Bodanski is developing and exploring. The scale at which we now need interventions and solutions is so big, it isn't going to be completely addressed by just expanding our workforce. We have to embed more mental health supports, at all levels throughout our society. And the last thing I was thinking about, which especially for this global audience that I think at our institution, the pandemic has really pushed us about, is our workforce, and not just, who are our psychiatrists and psychologists, but we know globally there are great models of community health workers or peer support workers in mental health. And I think trying to bring some of those models here to our communities and practice, which may be a much more acceptable way to link certain families and cultures to mental health, is a real opportunity from this pandemic that we shouldn't miss out on.
And Dr. Bodanski, you're doing some amazing work with the VR. You were talking about the avatar, and I'm thinking, hey, every day, Wolverine is my avatar, of course, and I just use that every day. And so I can imagine, how a kid, being able to use or talk to someone else, what that might mean to be able to get help for that child. Just speak a little bit more about the work you're doing, particularly with children. And, as we continue to try to, navigate the pandemic and coming out of the pandemic, what do you think that portends for mental health in terms of, where we're going? And because I know there are some people who have been vaccinated, but there's still a level of hesitancy that people feel with being around people. And given the fact that, we have been disconnected from our communities, from our families for over a year, some people may not be as comfortable going back to a normal life, or maybe even trying to decide what normal means now. And so for some people, there's going to be, a level of effort to be able to get them back to this place that we call normal.
Yes, I wanted to commend Dr. Dooley and Dr. Richards for the conversation. I wanted to share that going back to normal, like, we don't really know what that looks like. And I like to use the word adaptation, right? We have to prepare for this adaptation. We also have to prepare that we've gone through like 15 months of being very dependent on technology and video conferencing and Zooming and all of this, that this is becoming our new comfort zone. But on top of that, there's a lot more anxiety. And so I think one of the things that I've noticing in my own practice is safety issues. I think that combining more robust emergency protocols combined with our mental health services is very, very important. One of my partner companies, Air Visits and 911 telemedicine, I think it's important to have very robust 911, and now we're moving into a new designation, the 988 designation for emergency psych response. We have to, as providers, be trained and very aware of the emergency component, because what I've noticed with COVID, and now we're going into post-COVID, is we're going to have hundreds of thousands, I'm including millions of people that are going to be forced back into what is this, adaptation? Like, what is it going to be like for a child to go back to school or to be among their peers? I've already noticed with my own patient population for children is the amount of social anxiety that they're experiencing. And you think, oh, children, they just, they're missing their friends. Well, that's actually not the case in some circumstances, especially with new immigrant families that are still navigating through the system, maybe didn't have access to reliable or quality healthcare during the pandemic. And on top of that, that leads to a lot of behavioral issues with children. My big thing right now in terms of pediatrics and what I'm seeing in the emergency departments with my pilot studies is the increase in child anorexia. And that's a very serious, not just disease, but mental illness. And it can, the development of early child eating disorders can be very detrimental to child development and adult development. So the benefit of using novel technologies like VR medicine and combining that with we're moving into a generation as well as combining more neurological tools or biometric activity, which is what we do with my product. So having more sophisticated tools to treat mental illness, combined with, moving and adopting and moving away from traditional methods, I think with the aftermath of COVID is that we have to train and educate our providers. I think that's one of the starting point is actually training a new generation of clinicians, because 10 years ago, telemedicine was just, it wasn't very popular. You needed to go through all the cybersecurity. Now that's not the case. It's exploded. And now clinicians understand the value behind this, getting to remote areas, getting to rural communities, working with different populations. But on top of there's a lot of resistance to getting treatment in mental health. And that's where VR can be very beneficial for children, especially. And it's about the change that's happened with children is they've become so dependent on their technology, especially with the lack of social interaction, that again, it's created new conditions. My hypothesis is that post-COVID-19, we're actually going to see a different modifications, or what we see as mental illness is going to be, it's going to be slightly different. My hypothesis is we're actually going to see different strains of depression and anxiety that we weren't anticipating because of the disruption in child development. And I'm including health conditions, neurological, physical, and behavioral. And the benefits of using VR, and we're already doing this at Cedars-Sinai, is we're creating a completely new department for training doctors, nurses, and healthcare providers on how to be VR clinicians. Because that we predict 10 years from now, this is going to be the new telephone. This is going to be the new telecommunications tool. And using avatar technology, and also it's predicted that we're actually going to be moving into hologram technology. That's how you're going to be seeing your provider. And the customizational component is exciting because I know with my own patient outcomes, it's very beneficial for children. And I believe that, a lot of it has to do with, being removed from their comfort zones and now going into a new, what we call this new normal coming out of COVID. Well, let's make it nurturing for them. Let's make it an experience where they can see their doctor, have them change, what they're seeing, but also it's customizable in the sense that every session that they have, like say I'm working with Dr. Richards, every time that child is seeing Dr. Richards, they can actually have the empowerment to change her.
Oh, Erin, I've got to cut you off because we're running out of time. I'm sorry about that. Because I want to bring back in Dr. Richards and Dr. Dooley just to get closing statements from both of you in terms of what do you see post-pandemic in terms of the mental health community. Dr. Richards, let's start with you and take about a minute, and then we'll go to Dr. Dooley and close out.
So I think that we are going to see essentially a long tail. And if we look at this bell-shaped curve, right, this is we've peaked with anxiety, but I think this tail in getting our anxieties under control, our moods under control, I think it's going to be longer because we all are having to adapt and figure out what our new normal is, right? CDC came out with recommendations about who needs to wear a mask and who doesn't and what settings. And some people are panicking, some people are excited, but somehow we all have to coexist in the same space. And that's just one of the examples. Will the children be back full-time? Will they be back, in a hybrid model again? And so we need to allow ourselves to figure out what our stressors are, and those will be different, those will evolve, those will change. Are you now trying to get back in the office? Are you in a cubicle where other people are around and may or may not be wearing masks depending on the mandate at that time? So I think in general, to sum it up, there will be a need to evolve. There will be a need to handle both the therapy and possibly the medications to really figure out, how do I adjust to these new recommendations, to my new life as we come out of this pandemic.
Dooley?
Thanks, Dr. Richards. Yeah, I totally agree with the point about the long tail. And I think, for example, if you think of my 5-year-old patient who's in kindergarten, hasn't been to school in person the entire year, so is an emerging reader and, missed an entire year of in-person academic development and social development, I think the questions are going to be, what does 10 years of age look like for that child? What does 15 years of age look like for that child? And it might be a child who's been in a household that had a lot of COVID-19 impacts, for example. And so the challenges are going to be, are we going to invest in the people, the structures, and the systems that are going to help with this constant adaptation that's going to be required, and with really supporting and scaffolding kids' mental health? Because I think the outcomes that we could see are going to be much longer term than people are necessarily talking about.
Thanks so much for an illuminating discussion on these issues. We really appreciate all of you. And Dr. Richards, I especially thank you, because I know you've got a patient you got to see. And so for our audience, you can go to our expo and our networking sessions. And we also want to, again, thank our sponsors, Cigna, Children's National Hospital, the George Washington University, and Kaiser Permanente, for all of your support. And for our panel, you've been fantastic. Thanks so much for your time today.